Peace.
Peace.
This is Joshua Law, Mr. PhD. You're just now entering the cipher called Real to Real 360. K-Wise,
Peace, God.
bring that beat in, kid.
Indeed.
Peace.
Yeah. What's going on, party people? Welcome to the Real to Real 360 show. Let's get it in.
We do the knowledge and wisdom so you can understand. Real to Real 360 shows in full command. We changing the game for how it all was taught. From bondage to freedom to an independent thought. Yo, the show is here to bring about a change for real. To lighten everyone so we all know the deal. 360 degrees is a fact. We created the show to give our love back to our communities so we can know what's going on and give them the support from knowledge to born. So if you're ready to learn, then it's time to go. Sit back and relax and enjoy your show. Peace.
Peace. Peace to all our followers and listeners and individuals who've been staying with us since day one on Real to Real 360. I am Joshua Melalar, Mr. PhD. At this moment in time, I want to send a shout out to my co-host, Hey Wise, who is home with his mom, recovering from a surgery that she had today. Mother Khadijah, get well, and Real to Real want to send nothing but love and respect to you. But today's show, we will be speaking on the science of medicine, also human diseases, and we have Dr. Jamaine Davis that I will be bringing on shortly. And take your pen and paper, take notes, and pay very close attention while Dr. Jamaine Davis educates us on the science of medicine. And I'm bringing Dr. Jamaine Davis on right now. Peace, Doc.
Peace and blessings, everyone.
How you going? How you doing today?
I'm doing well. I can't complain.
Well, Dr. Davis, can you just give our followers and listeners a brief overview of who you are and what you do, as far as in medicine and how you got to that point?
All right, no problem. Yeah, so I'm a scientist, right? So I study kind of how the body works, and I specialize in an area called biochemistry and biophysics. So that's basically looking at seeing how the molecules and things that are in a cell work together to make us who we are, right? And so I decided to study, instead of studying study, to get a PhD because I wanted to understand how things worked, how the body worked. So as I went through my education, I learned a lot in terms of how some diseases disproportionately affect Black folks, right? So particularly for Black women have the highest cancer rates. So we want to understand why that's the case. So I have set up my research lab at Meharry Medical College, and I study that to understand what causes kind of this discrepancy or this disparity of why Black women have such a high rate of breast cancer or a death rate for breast cancer. I also serve as an educator. I teach in the medical school here at Meharry. I mentor students. I bring students into my lab to work, helping them either get into graduate school or medical school, and also try to inform them of how the body works and how to develop skills to understand medicine. Before starting the cancer project, I worked doing stuff like infectious diseases, right? So being a biochemist, biophysicist, I can work in any area of medicine. So before starting in cancer, I worked in infectious diseases. So I studied a lot about how bacteria and viruses can actually work and infect our cells and cause disease. So I have kind of like a broad area of training. Right now we're working on cancer, but I have also an interest in just talking about research because I realize that the community at large doesn't have the opportunity to call a doctor on their cell phone and say, what does this mean, or what should I do about this? So I want to find ways to bring the science to the community.
Okay. You had spoke about women getting breast cancer. What is the main proponent that helps or hinders Black women from getting the breast cancer? Because I've had nieces. My niece had it. My cousins and things of that nature was suffered from having breast cancer. So how can you prevent them? How can we prevent them or the next generation from getting breast cancer?
Yeah, good question. So there's a couple of ways to think about it. So for the most part, cancer itself, any type of cancer, is basically genetic. So a lot of times we're born with these genes that have what we call mutations, right? And so these mutations can disrupt the molecules in our cell to cause our cell to grow beyond control, right? So cancer is basically when your cells just continue to grow, and they're not really regulated. So there's a genetic component, which means that it's passed down in our family. So if a person has if a woman has breast cancer and it's genetic, there's a certain probability that risk would be passed down to her children. So we don't know how. So we're trying to understand exactly how that happens, and because we have different genetic backgrounds, it's hard to tease out one exact way that this happens. There's also sporadic breast cancer or sporadic cancers. So because we interact with our environment, so we go out, some of the foods we eat, we get exposed to different areas in the community, and if when it interacts with our genes, we can develop sporadic cancers.
Right.
So there's two main types of cancers. Unfortunately, even though the incidence or the rate that we develop cancer is similar, or the rate that Black women develop breast cancer is similar compared to other racial and ethnic groups, Black women have a higher mortality rate. So we want to stop that. We want to find a way to stop that. And right now, the key thing is diet, and a healthy lifestyle.
So a preventative measure for breast cancer, could it be less meat, more fruits and vegetables?
Yes. So typically those are the just lower moderation, right? So healthy eating, definitely fruits and vegetables, as well as exercise. Those are the key ways to really prevent most diseases. But it's hard to do that, right? Like, it's hard for everyone to do that. And so it's important to also monitor your health. So going to the doctor, getting cancer screenings, particularly for women, doing breast exams and getting checkups when they go to the doctor. Those are also the key ways to kind of reduce or preventative measures to reduce it from spreading or advancing.
Okay. So when individuals have breast cancer, what are some of the early signs that you might have? Or
that's difficult, because one of the other problems or issues with cancer is that at the early stages, there are very few symptoms. So people can be walking around with early stages, and if they don't go get cancer screened, they won't know. So for breast cancer, it's typically lumps in the breast. So any type of kind of irregularity with your body should be kind of taken and documented. So you should probably think about, okay, well, if a woman feels a small lump, she may pass it off. But as it starts to grow, that means that it may be developing and progressing. So the more we kind of stay abreast of keeping up with like doctor visits and screenings, we should be able to reduce that.
Okay. What was your motivating factor to getting into working in that field, far as working for a cure for cancer?
So one, because I noticed, so I didn't realize before I started doing research, I never realized that there was this thing called health disparity. So that there are these factors that influence how people health outcomes, right? So we knew about cancer, and probably everyone has been affected, or someone's family member has been diagnosed with cancer at some point. So I knew cancer was a pretty bad disease that needed some interventions. But then I found out that Black women had the highest mortality rate for cancer. Just Blacks overall have higher mortality rates for all types of cancer. And there are a variety of factors that contribute to this, but we don't know the basic details. And so I wanted to study some of these details, because if we know how it happens, we can potentially develop drugs to stop it. So it was seeing kind of like all these people who look like me and in my family suffering from this type of disease, that I said that it would be it would be really important for me to study it.
So, educationally, what schools did you go to get your PhD?
So I went to my first college. I went to Drexel. So I went to Drexel University and studied chemical engineering. I thought I wanted to be an engineer because, they got paid very well. But when I got into college, I started to think about research in biology. So I've always been interested in kind of how the body works, how our cells work, how we're able to, digest food. So I always had these kind of questions about biology. And then I've realized I probably with interactions with other people, I realized that a PhD would be a good degree to get, because it would help me understand the human body, right? So how we eat, how we develop disease, and how to prevent it. So I went to the University of Pennsylvania. So I did my PhD at the University of Pennsylvania in biochemistry and molecular biophysics. And so biochemistry is basically, how the molecules in our cells work together. And then biophysics is basically how they move and function within the cell. So having this kind of broad training, I then took that into move further, and I worked at the National Cancer Institute, because I wanted to understand. It's kind of like another training program, like a residency, like physicians do residency programs. This was a postdoc training. And I did this to understand a bit more about cancer. And so when I finished that training, I started my lab here at Meharry Medical College.
Okay. Meharry Medical College, that is located where?
In Nashville, Tennessee.
Nashville, Tennessee. So those of you that are in Nashville, Tennessee, get a chance to walk around and meet Dr. Davis,
right,
face to face, and ask questions. Dr. Davis, with understanding the cancers, and is breast cancer the only like focus of your attention, or is it all the cancers like colon, lung?
Right now is just breast cancer. But what I'm learning, so I kind of want to, as kind of like a big broad goal, eliminate all these diseases that affect Black people, right? So I want to understand how to stop the majority of Black and brown people from dying from these diseases at higher numbers than everyone else. So I actually have another project related to Alzheimer's that we're working on. And so we're still trying to understand how these diseases develop, particularly in populations like African Americans, and then find ways to develop drugs to stop it. Because, there's no cure for Alzheimer's currently, right? So, it's characterized by, dementia, but it's a progressive disease, meaning that it gets worse over time. So both of these, cancer and Alzheimer's, are basically diseases of aging. So as we get old, we're more susceptible to both of these. And then being Black gives us even a greater risk of developing them.
Now, what is it in our biochemistry that makes us more susceptible to these diseases?
Uh, there's a bunch of different, I guess, concepts or ideas. One
Mhm.
is diet.
Mhm.
Diet is pretty common. Another could be environment. Some of the if you look at there's scientists or researchers that go out in the community and they talk about how in poor areas the level of pollution and things that can contribute to poor health are higher in poor communities and black and brown communities. So
Mhm.
taking that together with diet and exercise or lack of exercise, those are some kind of behavioral things that would contribute to the risk of developing diseases in Black communities. Another one that people are starting to study is stress of systematic racism, right? So
Mhm.
there's evidence that suggests that people, have people that are under stress that can be due to racism have poor health outcomes. So or just stress of just trying to survive. Just all the stresses that we experience pretty much on a day-to-day basis will somehow contributes to our overall health. We don't know exactly, but we know that it's a factor. And so they're different specialists or research specialists trying to understand how each of those individual factors contribute to the high mortality rate as well as the high risk for disease. So basically, it's a bunch of different scientists coming together, sharing their knowledge about each of their special fields, and then trying to understand a bigger picture of how to, um, you know, eliminate this health disparity or health disparities in general.
Okay, so the contributing factors are the environment, poor quality of food, lack of education, and then also stresses, which works on the organs.
Yeah, which works on the cells,
Mhm.
even on the cellular level. Even more so because the cells basically can't really repair themselves very well, and causes downstream. It causes things not to function later. So like our cells are responsible for digesting our food and just waking us up and doing a variety of things. When they're stressed, they can die basically, and so when the cells die, um, that can lead to poor health outcomes basically.
Okay, so is there any way that you can rebuild your cells, or anything that you can do to rebuild your cells?
Well, the cells rebuild themselves every day, basically, but exercise and eating right is great. So eating in moderation as well. So not always being aware of how much calories you're taking in, because there's evidence that suggests that people who eat less live longer.
Hmm.
um, so that's a factor that may be important, and just trying to alleviate as much stress as possible.
So the foods that we eat that are injected with the steroids play a big part in the diet that causes diseases.
It can play a part, not really in diseases. It can probably lead to obesity,
Hmm.
um, but one of the probably more things is just overeating basically, or not having a balanced diet. Those are the ones that probably contribute more.
Yeah, definitely. When it comes to the stresses of today, how can we either release some of these stresses to take them off of our body and stop them from the wear and tear, or what? How can we prevent? In other words, how can we prevent receiving cancer?
Yeah, that's a hard one to describe, because our lifestyles can vary so much, but increasing exercise is always good. Eating a well balanced meal is definitely an important part, and the cancer screening. So going to the doctor and actually discussing and having a cancer screening. And sometimes doctors don't always give you the attention or respond properly, but it would be great to have someone to advocate for you if you can't advocate for yourself, and ask that. And I won't say force the doctors, but be stern about wanting, to schedule an appointment as soon as possible. We know that doctors are overwhelmed, but we also want to make sure we, as a patient, we're heard.
Right. Now, how much of the racial disparity is it when it comes to Black people or Black and brown people receiving medical treatment?
There's quite a bit. Unfortunately, there's quite a bit. One of the probably there's evidence that shows that for some reason physicians think that Black people can't feel pain the same way as white people. Mm-hmm. So when you complain about pain, when a Black person complains about pain, they don't necessarily get the attention or response from the doctor that helps alleviate that pain. However, if a white person does the same thing to their physician, they're more likely prescribed with an opioid or some drug to alleviate the pain. And that's kind of why, the opioid crisis has been so prominent in white communities. So it's this bias that physicians may have against what they perceive their patients should get. So to answer that is the disparity is that these biases that some physicians can have, can lead to kind of racial disparities in health and health outcomes.
So when it comes down to infectious diseases, like we've been through the pandemic of the coronavirus for last 2 years. How can we protect ourselves moving forward from different outbreaks that are coming about?
So the issue with infectious diseases is basically they spread viral, right? So they can easily spread. Mm-hmm. The hard part is trying to prevent that spread. Right now, the best way to prevent the spread is to get vaccinated, and also social distance. So because viruses basically have only one job, and that's to replicate. But they can only replicate if they get into someone's body. So the more opportunity we give them to infect us, the more opportunity they can, basically replicate and spread. When they spread, when they replicate in our bodies, they're trying to survive as well. So what they often do is they mutate. So as you see, we basically had multiple pandemics because each pandemic or each wave has been a different virus or variant. So the variant is trying to survive because, that's what it does. So these variants are created every time they infect. Well, not every time, but when the virus can infect a person, it can mutate and become a variant, and then that variant can then become more infectious and spread to more people. So every time we get infected, that's an opportunity for the virus to mutate.
Okay. So when you talk about the different vaccines and the vaccine itself, with a lot of individuals that are studying in Islam or Judaism that has an issue with taking the vaccine because of the unknown factors that is inside of it, and putting a unknown factor in your body. So is it animal based? Is it?
No. So I was actually hesitant to take the vaccine when the pandemic first started as well. The way it was marketed was, it just didn't, I didn't believe what they were saying. and it just came out of nowhere. So I had some issues with it as well. But the more I read about it and talked to people who study in that field, the more I understood about how it works. So it doesn't contain any animal products. It contains things that are in most other vaccines that help the body, to help the cells take in the vaccine. So you hear a lot about this mRNA, and mRNA is something that that we have in our body to help us produce the cells and the things inside our cells. We just understood that mRNA from the virus can also be used to develop a vaccine. So when you get the vaccine, the components are in the vaccines are like things like fats and lipids, because that we know that's how cells will take it in so that they can produce the vaccine or the antibody, and mRNA. So those are the primary components. It doesn't have any animal products, and once you do that, your body produces these antibodies, and they produce them in a higher number, and so those antibodies give you protection if you become infected from the virus. And it protects you from getting severe cases of the disease. It doesn't protect you from getting infected, but it prevents you or reduces your chances of basically dying from it.
Okay. With past vaccinations that we grew up taking, like the measles, smallpox, and things of that nature, would eventually taking the coronavirus vaccine, will it eventually immune us 100% from COVID-19?
So yes, it would, but what we're experiencing is that the different variants, right? So the variants have now, so the virus, because it's been spreading, has mutated. So it's not necessarily the same one.
Mm-hmm.
So that's why people who have been vaccinated get these breakthrough infections.
Mm-hmm.
So we're protected from the original strain. So when did this start? 2020, in March 2020. So that initial virus is no longer around, because what dominates is now this new variant, right? So we've been protected, probably not 100%, but we're 90 or something percent protected from that first one. Really protected from that first one, but the virus has had time to evolve, and it's created a more infectious and a faster replicating virus. So now the protection that we have is not as effective. So if we would have all kind of like, if we were able to contain it in the beginning, back in the early stages of 2020, we wouldn't be here today. We wouldn't still have the pandemic going. But because it mutated, that and people are not as social distancing as much as they should, it's continuing to spread.
Okay. We have a question from the audience from Divine. He says, is there any way that we can protect ourselves naturally and naturally boost our immune system?
Yes. It's not 100% though. Taking vitamin D. So there are some things that you can do just in general to be good practice and good health. So taking vitamin D, taking vitamins, eating healthy. But the issue with that is that there's no guarantee that will protect you. We would like to think that natural, our immune system can fight it off, and for a lot of people, their immune system can fight it off. But there are also some people who immune system can't fight it off. We don't know who we are. We don't know until we get infected. So in essence, it's basically taking a risk to say, okay, well, should I go with the vaccine or should I go with natural immunity? And so some people have been okay with getting the infection and living through it. But we've lost almost 1 million people who couldn't. And so if you want to take that risk, then it's up to you. So it's a personal choice, but you get more protection with the antibody.
Dr. Davis, also with taking sea moss and Bidarac and bladder root, would those help protect us from the coronavirus?
There's no evidence that they would. They will maintain your overall health, yes, but there's no evidence that they would basically prevent coronavirus. Okay. So those type of things are kind of in general kind of health suggestions, right? So, but there's no guarantee that if you get infected from coronavirus, from the virus, that it will because you have that, it will protect you from it.
Okay. With the coronavirus and these different variants, how can we get protected from the new variant, since we're basically just covered from the very first one, not the mutated or the grafted one? So how is we have to stay like proactive going forward with the new variants and the mutations? So how can we keep ourselves protected? Is it, you know what I'm saying, like a lot of people say wash your hands and things like that, but overall, how can we stay protected moving forward?
So I see it as a numbers game, basically. So there's certain things that increase your risk or the probability of getting infected, going out to big events, because we see that people are not wearing masks. And there have been people who have been positive for coronavirus and still attending these events, right? But you can't tell, because the main issue is a lot of people are without symptoms or asymptomatic, right? So the people who have coronavirus can cough and spread that virus. And they can cough just once and spread it, right? So to protect yourself, I'm still wearing a mask when I go out in public because you just don't know who has it. I'm not wearing any gloves or anything, but I still wash my hands and practice those hygiene, practice good hygiene to prevent any chance of me getting infected when I go out. So not attending large events. Also making sure that your health is up to par. If you want to go the natural immunity way, just be careful, and also just getting the vaccine.
Okay. Also, too, coming out of being locked in, you know what I'm saying, and not being able to move unless you were an essential worker, and then starting to be able to travel and move around, how scary is it to get on planes, public transportation, things of that nature, knowing that this variant is still out there and is mutating?
Yeah, so that's an individual choice, right? So again, you weigh the risk, right? So some people have to travel, some people can't stay home, some people have to go out to work and take the public transportation. So you have to assess that risk. Right now, it's the numbers are starting to increase, so that means that it's still spreading, right? So, but the more people are out, the more chance there is to spread. So there's some ways that we overall can't handle that, but I mean, we can't help that, right? Because we have to live, we have to go to work, and we have to provide. But there are opportunities to not do other stuff like these big events. So people who have healthy immune systems are likely to fight off an infection, but there are people who don't have healthy immune systems, like cancer patients. There are people who have compromised immune systems or even elderly, right? So if I'm going out to these events and I go home and take it to my mom or grandmom, that can spread it to them, although they've been practicing social distancing, right? I now spread it to them. So we also have to realize that, there's an opportunity to get it and not have symptoms, but also spread it to someone who won't be so lucky.
Okay, like we speak about the elderly and also those who are incarcerated have been getting a high rate of the coronavirus. So, with preventive measures for institutions, because we know that these individuals aren't traveling outside the facilities, um, how can we ensure that the people that work with these type of environments, work in these environments, stay healthy? Do you feel we should mandate those for not traveling, or?
Yeah, that's a tough one. So there are other policy issues that may have to come in fact, but when you're in kind of like limited space, so
Mhm.
like within incarceration and maybe nursing homes, you
Mhm.
can't social distance. So people are kind of forced together in closer quarters. So that increases the opportunity to spread to someone. So there should be some sort of regulation. That's why kind of when it first started, they prevented people from visiting nursing homes and such, because all it takes is one person to become infected, and then likely everyone's going to get infected, right? Because they're in such close quarters, it makes it easier for the virus to spread. So there should be some sort of guidelines to help prevent the spread, right? Because we don't want to deliberately spread it to someone, but if we don't change some of the policy, that's exactly what we'll be doing. So that's why a lot of these facilities had to shut down and prevent visitors, because they didn't want someone bringing it in, because it had the potential of infecting everyone.
Now, I've spoken with some people, and they're afraid to go to the hospitals because of scared to catch the coronavirus inside of these hospitals. So, how sanitary are these facilities now than they were before?
So there have been the kind of the reports that people get it in the hospital. The hospitals are very clean. They have to keep it clean for all patients in the operating room and different surgeries and babies being born. But what happened, what we didn't anticipate with the initial stages of coronavirus, is that the burden. So when so many people have contracted coronavirus, the first thing they do is go to ER when they have these bad symptoms. So if you have a emergency room filled with infected people, and you go into there, you're more likely to become infected. So because of the number of people going to the hospital, the number of people who had COVID going to the hospital at the same time, that, and then you being there, that increased the risk, and that actually probably contributed to the spread. So that's why it was important for them to say to social distance, that if you don't have to go out, then you probably shouldn't, because we didn't anticipate that the hospitals we could become overburdened, because there were so many people in the hospitals, they had no place to put them.
Mhm.
Now that the numbers are going down, they're taking more measures. That's why hospital, like sanitation workers and all, have been deemed essential, because they need to keep it clean to prevent it from spreading outside different areas. So the hospitals are still sanitary and clean, because they require the frequent cleaning of it. But if we get to a case where there are too many people going to the hospital, too many people who are positive going to the hospital at the same time, that would increase the chance of someone going for another issue to get infected.
Okay, so with the coronavirus mutating, and we're going from one stage to another, whereas we're starting to come back outside and we're starting to want to travel, we're starting to want to go back to what we thought was the norm. Do you feel that we will ever get back to that, to the norm?
No, I don't think we will, because we've learned, I think, a lot about how we functioned before, and particularly in some areas where, you know I think prior to COVID, we thought that working remotely or at home was impossible, or at least our employers said that. But we were able to function like that for, more than 2 years now. So there will be some shifts in terms of maybe a hybrid type. Some companies will do some sort of hybrid approach. But I think we've learned how much we're connected to other people and how much impact we have on the environment. And so probably not everyone has a strategy in place, but we are thinking about how to offset that so that our normal is changed in the sense that we're not as overworked, we're not as congested, we're not polluting the environment as much. So we're learning to figure out, we're trying, or people are trying to figure out what's the best way to do that. So it'll be a different norm, but we're not sure what that norm would be.
Okay, so going forward, the progressive step would to be a hybrid work environment.
Yeah, I mean, I think we learned it works, right? Like we were able to we were still able to function. A lot of companies, now we did lose a lot of businesses and people were shut down because they didn't have the manpower to function through the pandemic. But we realized that we can adopt these different practices to still function.
Okay. Now, other infectious diseases that we've noticed prior to the coronavirus that have come and gone, like the Ebola and things of that nature. How do these infectious diseases affect our biochemistry makeup if we have contracted it and survived it, like the Ebola, the coronavirus, and things like that?
So Ebola was very well handled, right? So we didn't have the same numbers of people dying from it, but it hasn't. And so it didn't have the opportunity to mutate. Coronavirus, on the other hand, is actually pretty bad because they're starting to see some people who've had COVID. Well, we've heard about this long COVID, so people have kind of these long-term symptoms due to COVID. So we know long-term COVID is something that we're continually monitoring. We also start to see that some people who contract COVID have developed diabetes. We don't know how or why yet, but people are looking into that. So COVID does have a pretty lasting effect on the body, particularly if you haven't been vaccinated. So people a lot of people who didn't get the vaccine and survive COVID. They show kind of tissue damage in their lungs. They also have increased cases of other kind of diseases like diabetes. So we're still pretty much learning what could happen because it's only been 2 years. But the best case is to not get infected, right? Because that way you don't have those worries about it.
Okay. Now, those who have the underlying health issues when it comes to COVID, how, like we talk about the vaccine, and the vaccine only helps not to get the severity of the disease, but it doesn't stop you from getting it. Really, how much of at risk are those with underlying health issues, asthma, diabetics, things of that nature?
They're definitely more at risk. One of the things that I think people didn't realize when COVID first came out is, there's stages to an infection. So if I get infected 3 days after, that's when the virus is really going to start to replicate, right? So 3 days or so after I get infected, the number of virus in my body are low. Five days later, the number of viruses are going to increase. So if I coughed on someone from day 3, I gave them a low level of virus, right?
Right.
When you have a low level of virus, sometimes, most of the time, the body can handle that. But if I was going out and infecting people when I had a high level of virus, it reduced their chances of having of surviving COVID, right? So it's a concept called viral load. So when the virus is in your body and it's low, and you give it to someone, the body has time to make the antibodies naturally and to potentially survive from it. Now, people with underlying conditions have a higher risk. It's harder for their body to do that. But if I'm very infectious and I go and cough on someone who has this kind of risk of cardiovascular disease or Alzheimer's, it's going to be harder for them to recover.
And
that's why it's best to kind of keep either social distancing as much as you can or wear a mask.
That's where I think there's been like a lot of conflict of with social distancing, especially when we're talking about traveling and being in close proximity on airplanes and buses and public transportation, because we're amongst individuals and not knowing the person that's sitting next to me health conditions.
Right.
So,
and even so, in the airport is another place that's probably where most people contract it, because that's where you're eating and you're taking down your mask at times, right? So the airport itself is also a place where people probably have contracted the virus.
Right. And I had a question, because when they started allowing us to go back inside to the restaurants, and when you go into the restaurants, a lot of people that just keep their mask off or whatever the case may be while they're eating. And is that good health practices?
Well, if there's social distancing, right? So if the restaurant is crowded, then it's not, right? Because then the person at the table next to you can probably spread it, right? But they're allowing this opportunity for people to go out to kind of stretch and live life, but they should still be practicing kind of social distancing as best as possible. Now, you have to take your mask off to eat, so minimizing the time that your mask is off is best. But going into, like, when you first walk in, that's when you want to keep that mask on.
Right. Now, going back to the very beginning of the show, we spoke about cancer and cancer treatments. How is chemotherapy have evolved from the very beginning?
How has it evolved to become better?
Yes.
So chemo is it's the standard method is pretty much the same. It just depends on kind of the cancer patient. So sometimes chemo is very effective, sometimes it's not. But what we're learning in medicine is that each patient may be different.
Right.
So chemo can work up to a certain extent, but the patient may need additional treatment with like certain types of other drugs to kind of help treat the cancer. So I would say that it's evolving, but it's evolving so that the cancer or the treatment is specific for the individual patient.
Now,
and that's called precision medicine.
Precision medicine. With looking forward and understanding that the Black and brown minority community are under attack when it comes down to cancers, infectious diseases, and we want to talk about the preventative. How can we eat better? How can we live better? What is the things that we can do in the Black and brown community to ensure our longevity?
Yeah, that's a big question, right? Like one of the things that come to mind is the community, build the community, right? So we need more Black and brown doctors. We need more Black and brown scientists. We need us strategically placed in all these areas so that we can take care of ourselves and trust, right? Because we've learned that, there's a big trust issue with African Americans and medicine, right?
Mhm.
So we need to figure out how to reestablish that trust so that we can take care of each other. So one is building that community. Two would be people feeling free to go to their doctor and have an honest conversation about their health and being heard. Eating right, knowing what a well balanced meal is, right? So
Mhm.
having bread, vegetables, a low portion of meat. The understanding what a healthy meal is what's going to help us kind of try to balance that as much as possible. Exercise as well. You don't have to run a marathon, but walking 20 minutes a day can really make a significant difference. There's also evidence that exercise even in 20 minutes can help with memory, and that can help with things like Alzheimer's and so forth. And then I didn't mention going to the doctor, but also having those cancer screenings. So being up to date, like maybe even having a health journal so that you record all the things that you think contribute to your health. And then when you go to the doctor, you have that conversation about it. So I think those would be the areas to help prevent and reduce it. And then we need to, and in terms of building a community, hopefully that would help alleviate some of the stresses associated with existing in spaces with structural racism and things like that. So hopefully that overall will help enable a better way of life and to reduce stresses and promote healthy eating and living.
Yeah, I was going to ask, how can we break the barrier of the racial disparity that we have? You know what I'm saying, when we go to the doctor and ease some of them stresses. Um, so to have a doctor that looks like me would do you feel would ease some of the racial disparity?
I think the dynamic would be: do you feel comfortable talking to your doctor, and does your doctor listen to what you say? Because it doesn't take, like, the doctor doesn't have to look like you, but they need to listen to you and provide the same quality of care, right? And so we're seeing that that doesn't always happen. But what we also see is that Black people don't always argue with the doctor, right? So when the doctor says something, we take it as their word and then we leave and that's it. But we need more advocacy in terms of, okay, well, if you won't do this for me, why not? Or you go to someone else who will. So being able to really talk to your doctor and have this conversation to really, make you feel heard is what's going to be really important.
Well, there's a statement from Miss Shannon Davis. I think that's your sister. And it's just it's cross contamination. The reason why we're coming up with new strands of coronavirus.
No,
Good question.
that's due to the fact that it's mutating. So
Hmm.
because the virus has the opportunity to spread from one person to another, it's mutating and becoming better. So the only way to stop it from developing a new strand is to stop it from spreading.
Hmm.
So the more it spreads, the more opportunity it has to mutate and to evolve and to become worse. And we've seen coronavirus like years. Well, we didn't see it in the US. I mean, there are different types of coronaviruses, but it did break out back in kind of, I think, 2012 in China. So these things are happening often, but it depends on how we respond to it, right? So if we would have been able to shut it down in the beginning, we wouldn't have had all these deaths.
Hmm. Now, speaking toward that, being that we knew that it was a possibility because it broke out in 2010, right? How do we contain the coronavirus? What can we do as a community to stop it from spreading? Do we have to go back into lockdown? Do we need to? What is it that we need to do to be a force, proactive force to stop and alleviate the coronavirus?
Yeah. So the key thing to keep people from dying is to get vaccinated. That's right now the best thing that we can do. The other thing would be to go through, social distancing, whether that be shut down or just minimizing your exposure to or your interactions with people. But as we've learned, that's kind of difficult. Those are the guaranteed ways to do that. But if you can't do that, using the masks, using gloves, or always kind of using some sort of personal protective equipment to prevent that spread. So because it's becoming more infectious, we need these N95 masks, right? Because those are the ones that will prevent it from coming through. If you can't get an N95 or KN95 mask, wear two surgical masks. So you want to prevent being infected by the virus at all costs.
Peace. We have another question from Born Unique. He says, "Peace. Will the corona pandemic become like the flu pandemic, epidemic?"
So I guess in terms of will it happen every year? Now, probably yes. So after, hopefully we'll get a handle on it soon, and we can minimize the number of people dying from it. But the coronavirus is not exactly like the flu. The symptoms are different. But once we get over these kind of variants, it will probably be part of our daily life like the flu is.
What do you say when people say that people have died taking or right after taking the coronavirus vaccine?
The vaccine. So those cases are rare, extremely rare, and it was likely due to an underlying condition. Because if you look at the number of people that have actually gotten the vaccine, I think, particularly in the U.S., I think it's like 80 million. The number of people who died, that's associated with taking the vaccine, there's no evidence that it was actually the vaccine, is very low, like 0.00 something percent. So it's still very safe. We've existed with viruses and vaccines for probably a century now, so we know how the virus works, and we know how the vaccine works.
Okay, Dr. Davis, we have our last question before we have to end the show. From Divine Law, Mr. James Small want to know, was the virus man-made?
I don't think there's no evidence that it's been man-made. It originated and it was just allowed to spread. So it spread from like bats and jumped into humans. And this has happened before. But I don't believe it's man-made. There's no evidence for that.
Okay. Well, Dr. Davis, we're coming up to the end of the show, and it was very informative and very impactful. And we would love for you to come back and do a part 2 as soon as your schedule permits. And if you can give me 5 minutes after the show, we would love to sit up and chop it up with you a little bit more. But ladies and gentlemen, you have witnessed some great information from Dr. Jamaine Saydu Davis, son of the great Lord Saydu Allah, who we all respect in Lord's Island. But the information that you take back with you from this young man who took time out and sacrifices to get the education, to be proactive, to bring the science to the Black community, I salute you, Dr. Davis. And I want you to know that you're welcome to come back to Real to Real 360 at any given time with any fruitful information that you have to share with our people. I want to thank all our followers and our listeners for tuning in and really taking the time out to ask questions, to be very respectful in the time that was given. And we just love the fact that we have our own people that will be able to come back and give us the information, because this is what we're supposed to do when you have a community and you have a village. So, Dr. Davis, I salute you and I thank you for coming on. Is there anybody that you want to shout out at this moment in time before we?
Yeah, I shout out to you. I think this is great. I'm glad this is a place that people can come to with trusted information. I thank you for having me. I thank all the listeners. And I'm looking forward to building that community. I'm not in New York anymore, but you know what we've learned is that we're still connected virtually. So thanks for having me.
You know, it was a pleasure. It's a pleasure all the time to have you to come on and realize that your family, you know what I'm saying, regards to whom or what, we're all family, we're all connected. And ladies and gentlemen, I want to say peace. Thank you for your time. K Wise, you know what I'm saying, we with you, my brother. You know what I'm saying, Mother Khadijah, get well. And it's all love. Peace. Oh, man.